Well, good morning, Ayanda. First and foremost, we think that it is for government to lead a comprehensive vaccine program for the country. When I say comprehensive, I mean to ensure that we get to herd immunity as quickly as possible, procuring the vaccines on the best terms and conditions under very challenging circumstances. Obviously, there's very significant competition to access those vaccines. And we see businesses being able to play a supportive role, provided that the allocation of roles and responsibilities is clearly set out and understood, that there's transparency and integrity in the process. And that role can extend from assisting in mobilizing funding to the extent that the fiscus itself is unable to carry the strain. It's possible, the minister has talked about this, that the private medical schemes can come to the party in a meaningful way, as well as you've indicated, in the context of logistics and distribution, through ultimately to the vaccination itself, using the networks that are available in the private sector, ensuring that we have a consistent communication strategy as a country to all of our population so that we're on the same page, and in fact administering the rollout of the vaccine in an integrated, coordinated manner. And in that context, we think that all of business can play and should play a significant role.
Yeah, there's a raging debate about, balancing commercial interests and interests that are leaning towards ensuring a greater public health, or public good, if you like. Do you feel that we're balancing these two things adequately enough? And I ask this because many people sort of raised eyebrows with the health ministry and the team. I think it was just a day ago announced that some things have to be kept away from the public because of things like non-disclosure agreements. And the minister sort of alluded to the fact that we sort of need to still tender towards what we're actually doing here, commercially speaking. But many people kind of expected that to be somewhat in the back burner, considering this is a global health crisis. And it's actually no one's benefit that anyone doesn't, in fact, benefit from a vaccine.
We think that there needs to be maximum access to the vaccine, as I said, on the best possible terms and conditions, and as quickly as possible. If we don't access the vaccine, the reality is that we're going to be living with the pandemic until then. We're now in an extremely worrying, as you've indicated, second wave, high levels of both infections and mortality. We anticipate there's going to be third and potentially fourth waves with devastating effects, not just on the healthcare of our nation, but also on the economy, and long-standing ramifications, probably 3-4 years to recover in terms of GDP as well as employment. So we have no option but to access the vaccine as quickly as possible, as I indicated. Now, we need to do so on a transparent basis where everybody has visibility as to what is going on. If there are non-disclosure agreements, we need to respect that. But in due course, people need to feel that the nation is getting value for money, that there is no profit that is being earned that is inappropriate anywhere in the system, and that as efficiently as possible, the vaccine from procurement to vaccination is actually taking place across the system, and that everybody is held accountable for their roles and responsibilities, as I indicated, in that process. That's the only way we're going to build public trust and confidence at a time where it's absolutely essential that we do have everybody aligned in the same direction.
Would you go as far as to say that it's unethical for any business to gain a profit from this vaccination program?
Well, I believe that people will need to ensure that they have an appropriate return on their capital, and that needs to be extremely carefully regulated. As a matter of principle, Business for South Africa, as I think you know, has operated on a pro bono basis for the past 9 months in the context of the pandemic. People need to be able to cover their costs. We operate in a competitive market, but you're absolutely correct that any profit that is made needs again to withstand full scrutiny, and it needs to be transparent, and there needs to be integrity in the process.
Yeah. Some people have gone a step further and started crushing the numbers. And I must say up front, I haven't independently verified this myself. But if the objective is to inoculate 67% of the population by the end of this year, that, as the minister pointed out, is about 40 odd million people. Apparently, if you actually do the maths, that would actually equate in us inoculating, conservatively speaking, about 100,000 people a day. And that's if we start on time, and this is based on us actually getting a vaccine as early as February. Are you confident that we are actually in a position to be able to pull something like that off? 100,000 people odd every day from the beginning of next month?
Well, that is hugely ambitious, as you say. It's predicated on accessing the vaccine immediately, effectively. The minister's indicated that it may be that by the end of the first quarter of this year, we'll start being able to get the vaccine for the healthcare workers. And there's a hierarchy of needs, the healthcare workers, the elderly, critical workers, the most vulnerable in society, those with comorbidities. So rolling out the vaccine is only effectively possible if we bring all of the resources, not just of the state, but of the country to bear. I think that is a very ambitious program. We can see around the world that many countries are having challenges in vaccinating their population. One other point that I must emphasize is that as a country, we've had a very negative experience in terms of distributing PPE, corruption, and indeed malfeasance. We need to absolutely ensure that there's no scope whatsoever for such activities to occur in the context of the vaccine. So we need to make sure that we have appropriate systems and governance processes in place, even as we ramp up our systems as a country. And to do that, we may need to measure the way in which we approach this as quickly as possible. But what I mean by that is to say in a responsible manner, so that we can guard against any corruption, that we can ensure that there is no egregious profit that is made, and that we're able to allocate the vaccines to those who are the most needy in society in an appropriate and in an efficient manner.
Yeah. Does it not concern you, though, that at least on the face of it, it appears those systems, those very crucial systems you've just outlined, are still not in place at this very late stage of our fight against the pandemic?
Well, we're talking to government about how it is that business can come to the party and provide support on the terms that I discussed. In other words, one of integrity, appropriate allocation of responsibility, and full transparency and accountability. I think it should concern all of us, but the reality is that there's not a country that we can see that isn't having to mobilize resources in the face, by the way, of very stringent economic and health constraints that we're all facing at the moment. So we need to manage expectations responsibly until we're able to start this process of rolling out the vaccine as quickly as possible.
Yeah, I mean, you allude to the plight of other countries in their fight to try put COVID-19 under control. One of those countries is obviously the UK, and it's most notable because it's making headlines across the world now with the reimposition of a nationwide lockdown for the next 6 weeks. If push came to shove and South Africa needed to go in that direction, is that something that you feel business should throw their weight behind? Of course, considering how devastating the economic fallout of something like that would be on businesses.
No, we're not advocating a return to a high level of lockdown. We support the fact that we returned as a country to adjusted level 3, particularly under the circumstances in which we find ourselves for level 3 in the context of the second wave, as I indicated previously. The economy, as you've properly stressed, cannot possibly stand a return to level 4 or level 5. I think we found an appropriate balance of keeping the economy as open as possible in the current circumstances. We need to try and ensure that we do curtail movement, transmission of the virus in whatever form, that when people return to work, particularly this time of year after the holidays, they do so and observe all necessary health and safety protocols. It's a matter of great concern to us that those protocols have not been observed as broadly as necessary, which is what has led, of course, to increased transmission of the virus. But we don't think that we have the fiscal ability or basis to be able to return to the sort of lockdown that we're seeing in the UK, a 5 or 6 week lockdown, where all of the weight is going to be on the shoulders of the sovereign balance sheet. South Africa just doesn't have that flexibility right now. I think that's fully understood and appreciated by all concerned.
Yeah, an added complexity that many people perhaps may have not necessarily predicted is the public hesitancy around actually taking a vaccine to try curtail COVID-19. How can business respond to that particular challenge, considering it's got to do with a whole lot more of the soft skills, doesn't it? This is not necessarily an obvious economic problem, so to speak, but one that needs a bit of a multi-pronged approach to try to convince people that a vaccine is not only safe, but quite frankly necessary.
Absolutely correct. So we believe that a comprehensive engagement strategy, communication strategy is necessary, not just to accompany behavior change, which is what we've been advocating for the past 9 months in the context of the necessary health and safety protocols, but also taking the vaccine and dispelling any myths that might exist about the harm that it might cause. We know that if we don't get to herd immunity as quickly as possible, as you say, we estimate that's 2/3 of the population, then actually we're going to be living with the virus just for longer than is absolutely necessary. So to do that, we need to ensure that we can again put the structures of business at the disposal of the nation to get that communication campaign out into every corner of the country as quickly as possible, and indeed as effectively as possible, so that we can dissuade those people who are uncomfortable about the vaccine that there are any adverse ramifications of taking it as soon as can be possibly achieved.
Oh, Martin Kingston, hopefully we have a good story to tell at the end of all of this. Thanks very much for your time. Certainly appreciate your weighing in